Scary stories / ghost stories from your hospital or work. Story 1. I've worked in healthcare for over 20 years now. I have a couple stories from working in nursing homes of seeing a figure in black shooting across the hall. Then in the next 24 hours a resident will die, and then in less than a week another one will pass as well. But my favourite story is this. I worked at a very small hospital, maybe 30 beds. It has been around for many years. In the basement is of course the old morgue, and there is one elevator that goes from the basement to the main floor outside the nurses' station. This elevator would come up in the middle of the night randomly and the doors would open. Then all the staff would get up to go find the patient who just passed away. One night my coworkers and I were sitting at the nurses' station. And down the short hall to our right we hear this TV come on and the volume is up as loud as it can go. One of my coworkers and I walked down and said hall to find the TV to turn it down. There is one room down that hall that maintenance has the door closed with do not enter signs on the door. After looking in all the open rooms there is no other room but the closed one to look in. We opened the door. There is nothing in this room except the TV. I walked in, turned the TV and said stop that, there is a sick baby next door who needs to sleep, so please be quiet. I walked out and closed the door with no further incident with the TV. Story 2. On one of my old floors I worked on we always had weird occurrences happen at night. It was a neuro step-down unit. This unit had glass walls so you could chat and monitor your patient. We had a patient who had a severe stroke and was non-verbal. Feeding tube restrained, total care, etc. They rarely had family visit too. In the middle of the night, their call light went off. When I answered it, a woman said, "He is really hurting, he needs his pain medicine." So I walk into the room to check on him. The room is dark, nobody is in there, and the patient is sleeping. I tell his nurse what happened and I go and sit back down at my desk. The call light goes off again. It is his room. Same voice, "Please, he is really hurting." I get up and walk back to the room. Same story. I tell his nurse and she gives him pain medicine through his pig and we reposition him in bed. The call light does not go off again. It was really eerie. Strange things happened on that floor. Story 3. I started my nursing career at a small and very old urban hospital. So small that they were closing it all up. I worked in labour and delivery and we were the only unit left. There were a bunch of clinics and offices but they weren't open nights / weekends. One night we had to do a reasonably emergent procedure on a patient who was from out of town, meaning she didn't have a support person with her. As far as I remember, the procedure was going well. I was scrubbed in. We were in the middle of it when the patient stopped responding to the anaesthetist. Her vitals were all normal but she just stopped talking to her, stopped responding to questions. I could hear the anaesthetist ask her, "Hey, are you okay?" a few times. After a few minutes, the patient started responding again, and all was well. I had her in recovery room, just me and her. The babies were in the NICU and things were pretty straightforward. But I did mention to her about the strange episode during the procedure. She said, "I saw my grandmother in there. I was so scared and I asked her to hold my hand but she told me that she couldn't touch me." That sure was something for a 23-year-old to hear at 3 o'clock in a room far away from any of my co-workers in a very, very old and empty hospital. Story 4. It was my second night with this patient in his late 80s. He was terminally ill and was leaving for home hospice. In the middle of the night, I go to do vitals and he's talking out loud in his sleep and fidgeting. Hadn't done it the night before. I wake him up and ask what he was dreaming. Tells me he was dreaming about being with his friends when he was younger, such as going to the bar and partying. Said it was some of his favourite times in his life. I thought that must have had a great dream and left when I finished care. A couple hours later, I had left with a coworker to pick up a patient. When I returned, all of my coworkers are freaking out, even our senior nurses. My patient was on portable video because he could be forgetful at times. On the camera, they had witnessed multiple orbs shooting through the room that had looked similar to shooting stars. We get that from time to time, but they said that there were a crazy amount to where the room looked like it was glowing. Some coworkers even went in to check. When they did, the video person said they would disappear then return when staff left. By the time I returned, the orbs had just stopped. About 30 minutes later, my patient wakes up and decides to get up from the bed. I go in there and thought it was weird for him because he didn't really do that the night prior. I ask him where he's going. He points to an area behind me and says that his friends are here and want to play cards with him. My coworker who was with me paled. I just said that they should play cards when it was a little later and tucked him into bed. I thought that this whole situation was pretty wholesome. My coworkers thought I was nuts, haha. I was like his friends, just wanted to stop by and say hi. Story 5. I have 3. The first is our unit was moved to the old pediatric floor for a renovation. It was like 3 a.m. and the call bell goes off. This patient is furious because the PT next door has been banging on the walls. We could hear the banging. We apologize, tell them we will go talk to them. Walk into the room next door. The bang stops and that PT is sound asleep. Second story, had a patient for a couple months. I do oncology, so our patients get sick very fast. He was on comfort care and pass alone. Take him to the morgue, they clean the room, new patient gets in there. Poor lady calls in the middle of the night that there is a strange man sitting in her room. We go and she is like, I swear he was just here. She describes him, yep, exactly like the former patient. Last one, again another patient that we took care of for a few months, a very sad situation. The room is right next to the nurse's station. He had been a very confused active patient in a low bed, so constantly setting off alarms. He passes, the room gets cleaned and placed on hold for a new admit. His call bell went off all night long. Finally one of the nurses went in and yelled at him that it was time to quiet down and let us get work done. The call bell didn't go off again. Story 6. Work in a trauma/burn ICU. When I was on nights, had a patient go ballistic screaming about the dark men, we were trying to get her, etc. Weird as she was previously oriented in, but maybe she was having a bad dream. Dropped dead during a day shift. Used to work in small rural hospital. And when transporting a patient up to the floor, the room right across from the elevator, and a little old man trying to figure out his TV button while up to the chair. Make a note to ask the nurses up there to help, and when I bring it up they say the patient in the room is female and on comfort care. She's a ward of the state and doesn't have any visitors. Charge takes a walk with me down the hall and sure as shit there's no visitors in the room. Last one. When a curtain RT attending and I work, we are the deathly trio. At least one person goes, usually in room 27 or 43. So we're working, patient starts to circle and 27 went from the middle of the unit, another nurse is yelling for help. She walked into her patient's room to find her with her subclavian line out. Painting on the walls in blood to protect everyone from the shadow men. When my CW tried talking her down, the patient saw one of the shadow people in the halls and lost her mind. Few minutes later we start coding the patient in 27 and were unable to get them back.